Welcome back to another Research Connection. I'm here with Dr. Liara Gonzalez. She is an Associate Professor in our Department of Clinical Sciences, and she's going to talk about her lab's focus and research projects in equine colic and gastrointestinal diseases. So your work focuses primarily on equine colic and then gastrointestinal issues, which are two very different things affecting two very different species, but where is the link that you find in your research that connects those two things?
Yeah, so actually colic is the leading cause of death in horses between the ages of 1 and 20. So it is really impactful to horses, and that is what inspired me to pursue gastrointestinal research and colic, was because of my experience as a clinician and struggling to treat horses. I could have one horse go to surgery and it really not have any complications, and another horse with the same exact issue come out and have all kinds of complications. And so during my PhD, I started to learn more about that humans actually have maybe different types of things that cause colic, but humans, and particularly babies, also have some pretty severe causes of illness that are derived from obstruction of the blood supply to the intestine, which is one of the most severe causes of colic in horses. And so that's how the link sort of came together, was similar diseases in both species, both humans and horses.
So thinking about comparative medicine, your lab uses obviously horses as a model and also pigs as a model. What is the benefit of using the large animal model for human medicine?
Yeah, so they're higher order species. So a lot of other basic scientists and research uses rodents, and although there's absolutely a benefit, my work is more translational. So it means that because I'm using higher order species, particularly the pig is very similar physiologically to humans in many, many aspects, and particularly their intestinal tract and how it functions is similar to humans. And so I'm able to use these animals as models, and hopefully that means we're one step closer to coming up with treatments that we can apply to humans and to help people when they are admitted to the hospital.
And then stem cell research is also a big part of your lab's focus. Can you talk a little bit about the benefits of stem cell research and where you see that going and what it's already accomplished in your lab, in your studies?
Yeah, so I think stem cells are super exciting, and that's because they are a source of new cells and a capacity for the intestine to regenerate. So the intestine actually has an amazing capacity to regenerate just naturally, and I didn't know that the intestine had stem cells until I started doing basic science research after my clinical training. Or maybe I did, but then I forgot. I'm not sure. But anyways, the fact that the intestine can regenerate and that the research that we're doing is helping to understand what activates those cells to enhance regeneration. So when the intestine is injured, the inside, the things that are within the lumens, the inside of your intestine, is actually quite noxious. And so some of the most sick patients is when there's a compromise to the lining of the intestine and those noxious material can pass into the bloodstream. And so what my research is trying to do is trying to enhance how the stem cells respond, activate so that it can renew the intestine at a faster rate. And so we've got very cool, of course it's cool because I'm biased, but research looking at a subtype of intestinal stem cells they're actually injury resistant, and we've shown that they may actually be key to enhancing the regeneration of the intestine after it's injured in disease. And so that's pretty exciting work. And then we also are applying that to specific disease types in humans. So neonatal necrotizing enterocolitis, say that 10 times fast. Or NEC, which afflicts babies, is one major focus of our work, and intestinal transplantation, which is not something that we can do in veterinary medicine. But again, because the pig is this amazing translational model, we are actually able to use the pig to study intestinal transplantation, and we've really have some pretty exciting work that will hopefully we'll be able to apply to help people and improve the outcome of intestinal transplantation.